Hi everyone, good morning. Welcome back to IMG Chronicles with Dr. Shayee. This is a Christmas speciale. This is titled Nuggets for CaRMS Applicants 2022 session. So if you are applying this year, be on the lookout at the space. I'm going to be sharing in the next couple of days nuggets with some applicants from last year and the year before on mistakes they made, things they learned, and tips to help you succeed for your application this year. So watch this space. Thank you. See you soon. Your favorite Canadian IMG. Hi, viewers. Good morning. Welcome back to another episode of IMG Chronicles with Dr. Shayee. And today we've got two very lovely guests. So I want to welcome and introduce Dr. Gerlin and Dr. Peace to IMG Chronicles. Welcome. So you guys, you want to go ahead and introduce yourselves?
You can go first, Peace.
Okay. Hi, so my name is Pisa Shemokai. I'm an IMG. I originally came from Nigeria, or I'm from Nigeria, and I did my med school in Nigeria, and then I relocated to Canada in 2017, and then I was successful in the CaRMS March of 2021.
Thank you. So Peace is a pediatric resident. So thank you so much for joining us this morning. And Dr. Gerlin, over to you.
Hi, everyone. I'm Gerlin Gill. I was born and raised in Calgary, and I went to med school in Ireland, so Canadian studying abroad, but also in IMG. I matched in the 2020 match, and I'm doing family medicine residency with the University of Calgary.
Thank you, ladies. You know, it's so cold outside. You should be in bed drinking tea or coffee if you are not on call. So myself and our subscribers really appreciate this. So I think first I want to welcome everyone who is new here. If this is your first time, very welcome. So this is a blog that I'm an IMG myself. You've probably seen a bit of my bio, and I just do this to support everyone who is trying to get into the Canadian healthcare system, either Canadian or if you're a bona fide IMG like me. It doesn't matter, you know, we're all trying to get into the system, and that's why I do what I do. And, you know, this is so special because I started this exactly a year ago, a few days to a year ago. It was Christmas last year when I started, which is my most favorite time of the year. It's my birthday, born on Christmas Day, actually. So welcome, everybody. And if you haven't subscribed yet, don't forget to like, share with your friends, share with even those who are not in Canada at the moment, because this information is one that a lot of people need, and we do not readily have these things in black and white out there. So once again, thank you to our guests this morning. So I am joining you from Calgary, Alberta, in Canada. So for today, you've seen the topic already. We are talking CaRMS. Some may not know what CaRMS is, but that is the Canadian Residency Match Service, you know. So to practice here through the residency route, you have to apply through CaRMS. And this is the heat of that season. This is that hot time of the year. People are applying, people have done exams all year long, you know, so this really is a stressful time, you know, but I'm hoping that one or two nuggets we share this morning will make the process less stressful and will give you some tips on your application this year. So who wants to go first? it's going to be very informal, really, and the whole idea is that for some applicants, this is their very first time. For some, they've applied more than once and they're thinking, what else can I do better? So I'm so glad you're here to share from your personal experiences, which is very different. You're both in two separate specialties. One of you is in family medicine, the other is in pediatrics, so I'm sure we're all curious to hear what you've got to share with us this morning. So over to you. Jump right in.
I guess I can just talk a bit about. So I applied my last year of med school to programs across Canada. I guess like in terms of where you go to med school, you may have more opportunities to do electives or you may not have that many. I would suggest if depending on the specialty you wanted to, make it more broad. So you don't just have to do internal med or family med electives. They like a variety of experiences, which is fair. So I didn't match the first year, which is totally fine. But I guess in terms of what was different the second year, I had a year off to kind of explore more of Alberta. So that's where I wanted to match anyways. I was able to do more observerships and it's experience that they want, just to know that you're kind of familiar with the healthcare system. I think that really helped. So even if you're doing observerships, research, if you're shadowing, it doesn't really matter because I know electives are hard to get after you graduate. Technically, you're not allowed. So observerships are the best way to get into a clinic, know what's going on, the resources that are available. So I think that really helped. And then I guess other aspects, just make sure that you do give your personal statements some time. Just have like a first draft ready at least a month before a deadline and then, or even 2 months, and just make revisions or get someone else to read it. So it can be a family member, but I would suggest someone totally objective who doesn't know you that well, a random friend that you've met or an acquaintance, just because you get that objective perspective, which really helps. And then also spending time on your CV, just making sure it's polished, you have everything you've done on there. And then even if you've done lots of clinical experiences, just highlighting something you've learned from each one, just to show like a breadth of experience, especially with family medicine or internal med or even pediatrics. You want to know what you've learned from one specific experience. I could go on more, but I guess like as the conversation rolls, I can add in stuff too.
Yeah, thank you so much for sharing that. I just want to ask a few questions based on what you've told us. We regard your observerships. Did you do them within a hospital or was it just random family clinics?
So I didn't do them in hospitals. You can get them. They're just really hard. I did try. I think if you know someone, it's better, but I just did them in family medicine clinics, a few different ones. And if you're going for internal medicine too, I don't think it matters because I've heard good things from everyone who've matched to internal but did electives or observerships in family medicine. Yeah. As long as you're showing that you're aware of the city or the province that you're in and you're willing to learn more about it.
All right. So what I hear is that for the province that you're primarily interested in, it's really nice to know a lot more about that province and spend time there to show that you're interested. Is that what you're saying? Yeah. And that certainly resonates as well. Okay, thank you so much. And as for Dr. Pierce, let's hear from you.
Okay. So I matched like in the CaRMS of 2021. I actually applied for CaRMS twice. So that was my second round of CaRMS. So I would say one of the things that I learned like along the way is you have to give yourself time. You have to start early. Golin said that already. It's something that it's the closer you get to the deadline, the more likely you are to make mistakes because now you are like under pressure, you're panicky. So something I did that was helpful was throughout the year, because I had done CaRMS the previous year, I kind of had an idea of what I was expected to do. So throughout the year, if I maybe get a random thought on, okay, this is one of the reasons why I want to do pediatrics, I had a book, I would write it down. So I kept writing down like different random things about myself that was helping to build the profile I wanted to project as someone who was interested in doing pediatrics. Something else I was also going to do, my other option was going to be family medicine. So I also had to start thinking about things that I have done, experiences that I've had that would probably make me a better candidate for family medicine. And then by the time I was starting to write my personal letters, I already had like this background of information that I could build off of. So that was very important for me. Then for the CVs, I got somebody to help me do the CV who's actually like a faculty member, who at that point was like a mentor to me in a different specialty. But being a senior physician, that person was also able to help me like tease out the most important things that I need to project on my CaRMS CV. So I would also go with saying you need somebody to probably help you look through your CV. Then I also installed Grammarly, because when you write, you are kind of blinded to your own errors. But then with something like Grammarly, I paid for like the premium version just for the period of CaRMS, so that I was sure that, okay, even if you have the right message, it's also grammatically correct. Then for the personal letters, I think having like a background helps you, and also having different letters, because like different programs require different things. So you also have to have that variety, because some programs are asking you totally different questions from other programs, and then you just have to spend the time doing that. Then I would also say the help of your friends, your family, like it cannot be overestimated. I remember like bugging even Shayee and saying, you have to help me. I have this thing I want to say. This is how I want to say it. What do you think? And she's like, okay, let's do this, let's do that. So things like that are also very helpful. You have people helping you to refine what you're working on along the way. And by the time it gets very close to CaRMS, everyone becomes very busy. So if you start early, I think that's one of the major things I would say. And then when it comes to the interviews, having friends that are also preparing for CaRMS would also help you to practice like amongst yourself and things like that.
Thank you. You know, you guys have hit the nail on a couple of similar things, you know, which I completely agree with. So I hear the word start early, start early. So I think this year, if I'm not mistaken, interviews are going to be like March. I'm not sure when the deadline for submission is, you know, but start early, you know, not a week to the deadline, 2 weeks to the deadline, just like you've both said, you know. And then secondly, getting that outside person to have a look at your resume, you know, is so important. I remember when I was applying through IMGA. So IMGA is the Alberta International Medical Graduate Association, AIMGA. If you do not know them, they're very good resource. And now it's not just for people in Alberta. Anyone all over Canada can actually join. So look them up online, join the organization, pay the membership dues. It's $50. You know, I don't know if it's changed. I don't think so. But it's $50, and what you get cannot be quantified, you know. But through them, I was able to get a professional to actually edit my CV. So I was able to compress my 11 pages into 6 pages that was clear and concise, you know, because people peruse these things. You've got thousands of applications. And for the IMGs, for example, in my program, they only were going to choose 10 out of this 1,000. So you do not want to make it so bulky, but at the same time, you want to project all the important things that you have done, right? So I think what they've both said is so, so important if you're listening and you're applying this year, you know. Something that I think would be nice to put into context is some people have asked, you know, how somebody has asked me, I'm in my 40s. Do you think I can get into residency? You know, somebody else has asked, oh, I've been out of school for XYZ number of years. Do you think I can get in? So if you both can just give us like a short insight into how far out you were, what you were doing just before you matched, would that'll be helpful?
For me, I guess I matched a year after I graduated, so I did apply twice. I think the difference is just more experience. And I've been told that by various, like a couple of programs that I was doing electives, they like more experience. It doesn't matter if you're doing like an intern year somewhere else or you take that year off to travel or do clinical work. It they like experience.
So
So
when you
like
say experience, do you mean clinical experience?
yeah, so like I said, observership or shadowing or research in particular area you wanted or any province that you wanted to match in. And then you can take time to travel because they like that too. But I don't think age matters at all because we see in our programs and everywhere else, people, even med students in Canada and residency graduates, they're various ages. Age does not matter.
Thank you. Thank you for stressing that, you know. And for Gerlin's med school, you know, you actually had the opportunity to do your housemanship, right? But you didn't do housemanship. Correct me if I'm wrong. So it didn't matter, you know. So don't stress and feel like, oh, I need to get more clinical experience in that country where I have trained. If your goal is Canada, then I would suggest that as soon as you're done, you know, while you're still in school, like Colin said, if you're able to do electives, that's perfect. But we know this past 2 years have been almost no electives with the pandemic restrictions. And the programs know that, they understand that, and they're taking that into consideration. No one is going to penalize you for that, you know. So if you do not have that and you come to Canada and then you get the observership experiences, that's also very useful because then you get to see how the system works here. You get to have an idea of what our EMR is like, what our culture is like. You know, I think that culture is very important in terms of the cross-cultural competences. You know, the way the people in England behave is different from the way the people in Nigeria behave, and is different from the way Canadians behave, you know. So you get to experience that, and then you really get to see the patient's expectations of when they come in to see you. So it's really a good idea, you know, for if you're applying for it to have that in your portfolio. So please, do you mind telling us what your background was just prior to your application?
Okay, so just prior to my application, I was working as a clinical assistant in Calgary. And so I had worked as a clinical assistant, I would say, for approximately 2 years. I think that's also important because prior to coming to Canada in 2017, I was already doing a bit of, like, I was done with med school and I had started my residency training in Nigeria, but then I had to come here, so I didn't complete that training. So when I came to Calgary, I was able to get a job as a clinical assistant in the NICU. I think that also helps with what Shayee just talked about when it comes to knowing the culture, knowing the work culture. And I would say using the language that is expected because it's different from various countries. Like it's different wherever you work, every culture, like work culture is different. So I think that was very helpful for me. Then I would also say if you have more experience, that's fine. But at the same time, I think the most important thing to demonstrate is the willingness to learn. Because no matter what you do previously, you're still going to have to learn. Like you keep learning along the way. So I think it's good to have the experience, but if you don't have the experience, it's also not the end of the world. As long as you're someone that is willing to learn, which you would show in things like going for observerships, looking for electives, because you have to go the extra mile to want to learn, to be able to like seek out and tease out those positions. So I think that's also important. I also did one observership in pediatrics. I wasn't lucky enough to like get like observership opportunities in family medicine, but this also help you to get like reference letters, people who are willing to like speak on your behalf in case they need to call any of your referees and things like that.
Yeah, thank you. That is so loaded, you know, and for people who have not had that opportunity for a clinical experience in terms of actually working as maybe a clinical assistant, like Case did, or some people actually have worked as medical assistants, don't worry, you know, your application is still solid. I didn't do any of those two, you know, and the year I matched, of the 10 U of C IMGs that got into family medicine. Two of us had no prior in terms of clinical work experience. I had done clinical research here, but the other person hadn't even done anything in the Canadian system with regards either research or clinical work. So two of us, and then 5 people were actually clinical assistants. There was a surgical assistant, and there was someone from Ireland and someone from the Caribbean, who had done all her previous observerships in the United States and electives, But so it was a very robust mix, right? With different backgrounds. So don't think that you have to tailor yours to exactly someone else, or to somebody who matched last year or prior. Just be authentic, be you, put as much of yourself as you can, because that is the only snapshot to getting to know you, and you want to put your best foot forward. That personal statement is so important. Some programs will tell you they want exactly 500 words. Keep it at 500 words. Some will tell you, I want 750. Keep it at that. Use your word count, and read it over and over. Get somebody else, like they've said, and I think these are things that you would expect an applicant to know, but it cannot be overemphasized because it is so important. If you were to give an advice on what you did differently the second time as opposed to the first time, please. I know Berlin said, she came and she had more clinical experiences in this country, in the province where she wanted to march in. Please, what was it for you that you did differently this time?
Okay. I would say some of the differences like between the first time and the second time was, for the first time, I got one interview in my first year.
Okay.
And unfortunately, I did not match that year. At this point, I think I probably lost count. I can't remember off the top of my head. I'll have to count on my fingers, but I had like lots of interviews the second time. So that was even also very reassuring for me. So I think one of the things that happened was, one, I had done it before. So doing it the second time, I was more confident in myself. And I was probably able to walk off like the prototype and maybe like the previous personal letters I had written and all. I had worked for longer in the system, so I was able to get like Canadian references. I think it's important, but at the same time, the previous year I didn't have any Canadian references. This was this time around where I was able to get like references within the system. At that point, I had completed all my exams. So I did a QE2. Okay. Then I redid my NAC exam. I had passed NAC before, which is the exam you need to do as an internationally trained graduate. So when you do the NAC, I think at that point, if you have a score over 70, it was considered a good score. But then I did the NAC again. So I had passed, and it was an okay score, but I did it again, and then I got a superior performance this time around. And then I also was able to apply for more programs. I know Golin had mentioned something about that. I probably applied for over 34 programs. Like I applied to any program that was going to take a doctor in pediatrics or in family medicine. So that also gives you a lot of options. And then by the time you are doing the interviews, by the time you've done 1, 2, 3, 4 interviews, you become more confident also. Because then you are able to like work on yourself and become better with every interview you get to attend. So I think basically these were like major differences. And I also had the help of my mentor who was actually like coaching me through the process also. I was able to get help from my friends and family, like because I started on time this time around. So I think it was just a combination of all the different like factors working together.
Yeah, thank you. So if we are going to leave a parting statement for the applicants this year, what would you tell them? Garland?
So I think start early, take your time. And if we can do it and everyone else who's matched, you can do it. Like just, I guess, keep your hopes up, like thinking positively, working as hard as you can, but also allowing yourself the time to just kind of think through what you really want. And then just knowing that it doesn't matter how much time it takes. If you want something, you'll get it. And then just be like, I guess, be confident too.
Yeah.
And then, because you're working hard, you're trying, we all tried really hard, and it'll happen.
Yeah.
And just, I guess, good luck to everyone. It's a long, stressful kind of road, but it's good, and you learn lots of things throughout the way.
Yeah, so true. Peace.
Yeah, so I would say you can do this. This is definitely something you can do. It looks impossible. It looks like it's a Herculean task, but this is something that you can definitely do. Just keep your head down. Just do what you need to do. Have a lot of faith. Believe that you can actually do this. And if you need help, don't be shy to ask for help along the way.
Yeah, yeah. Thank you so much, ladies. None of this is textbook scripted, this is life experiences, which I tend to think that is the best teacher, so thank you for sharing this. And I'm sure the subscribers of IMG Chronicles are very appreciative of you taking the time, and I think in parting, I'm just going to say, if you do get that interview invitation, know that that is not the end. That is just the beginning of another level. And one of the ladies this morning has said, have a support system of other people who are also preparing, so I want to encourage you not to see other applicants as competitors. Yes, they are, right? But so you guys are working towards the same goal. They're able to give you feedback, critical feedback. You're able to give yourselves feedback, and you're just setting yourselves up for success, Some positions have just one, and you're going to get invitations. You know about 5, 6 of you preparing for the same interview. I have been in situations where I've had all of those candidates, sit down with me in the same space, and we shared the same thing, and they all had different experiences at their interviews, So take advantage of that. If you've got any preparatory official sites, like IMG, they talk you through, the interviews, take advantage as well. And I look forward to doing another session towards interviews, like what do I need to know going in for an interview? How do I need to dress? How do I need to talk? The night before, should I take propanolol? These are many more questions. Hopefully we'll have people join us, for us to talk about this before your interview sessions. And again, if you haven't spoken to anyone about all you hear and learn from on IMG Chronicles, please do so. This is our space. And have a very, very happy holidays. I hope you get some time off and you're able to spend time with your loved ones. And again, thank you for joining us this morning on IMG Chronicles. It's been such a pleasure having you.
Thank you, Shayee.
You're very welcome. Don't forget to like, share, and subscribe with IMG Chronicles. Thank you.
Kindly subscribe. Don't just watch it and walk away. Many need this information from all over the world who are interested in coming to Canada to work as doctors. So kindly share, like, subscribe, follow us on all of our social handles.